ACON standards are for perioperative nurses to be sure there is a consistent level of care across Australia. This ensures safe practice and the best outcomes for patients in their care. They are also designed to have subject matter that replicates contemporary perioperative nursing practices and meet all relative state and territory laws. The ACON standards is a document that may be referred to in a court of law if it's found that a nurse is not meeting the minimum standards expected of them as a perioperative nurse. They apply to all perioperative nurses, including anaesthetics and recovery. Surgeons and anaesthetists have their own college policies and guidelines that they're supposed to adhere to. For example, the Royal Australasian College of Surgeons has chosen to adopt the National Health and Medical Research Council's Australian Guidelines for the Prevention and Control of Infection in Healthcare. The ACON standards apply to perioperative nurses in conjunction with a number of codes and competencies like the Nursing and Midwifery Board of Australia's National Competency Standard for the Enrolled Nurse and National Competency Standard for the Registered Nurse. These standards all address safety within their domains. An example of how ACON standards are incorporated into policy is that Queensland Health requires that perioperative nurses be recorded as competent in all areas, in areas such as aseptic technique against the ACON's competency standards. There are a number of ACON standards that address the use of personal protective equipment. Surgical or perioperative attire and personal protective equipment are included together in Standard 11. Some people may also consider surgical gowns and gloves to be surgical attire. This is explored in great detail in Standard 21. These particular standards exist so nurses know how and when to wear personal protective equipment and what is considered correct surgical attire. The ACON standards also remind nurses that personal protective equipment shall be provided by the employer and worn according to occupational health and safety needs and are specific to each activity. The standards also apply to nurses being aware that all visitors to theatre should be educated about wearing correct personal protective equipment and infection control practices. The Association of Perioperative Registered Nurses in the United States have a similar document called Perioperative Standards and Recommended Practices. There is a long legal disclaimer at the beginning stating that it's not their fault if anybody is injured by following their recommendations. The participation of nurses in their recommendations is also voluntary. Whilst the AORN standards and recommendations are very informative, there is a lot of information. They provide similar information to the ACORN standards and are very thorough, but they're not user-friendly as the ACORN standards. The AORN recommendations are released annually and available in a number of formats, including an iPhone app. What could be better about the ACORN standards? The ACORN standards currently are published biannually, which means that research may not be as up-to-date as AORN, and at $300 they're considered expensive by many nurses, and this makes it difficult for them to access them freely as they don't have their own copy. What's good about ACORN standards? They're easy to find what you're looking for and simple to read. The background, purpose, rationale formula is effective, and the research is conducted by the Joanna Briggs Institute, which is considered a trusted source of research and practice information for nurses. The 2014-15 standards will be available in PDF format and also on an iPhone app, which will be subscription-based for $150.